Early screening, vaccination, and treatment of pre-cancer affected tissue are some of the ways to prevent cervical cancer. Yet, it remains to be the fourth most common cancer among women globally. Hello everyone and welcome to Our Voices. I am Semeni Sheikh Oye and I'm joined by my co-hosts Oriane Itang-Shaka and Ginny Niwa. Today we'll be talking about what cervical cancer is and why it contributes to be the most common cause of death among women in sub-Saharan Africa. Hello ladies.
Hello, hello. Serious topic today.
Serious topic. And I have a question. Do you know that we as women need to do a cervical cancer screening every 3 years or every 5 years depending on our age? Have you ever done it?
Yes, definitely. For me, my doctor has actually advised that I do it every 2 years. They're now starting to advise women to do a little bit sooner. So I try to do it every 2 years, what's called a pap smear here in the US, the actual test that tests for cervical cancer. So I've been doing it actually since I was a teenager. Try to do it every 2 years, and now that I had children, I continue to do it every 2 years. So yeah, pap smear is very important.
Okay.
So I grew up, growing up in France. When you have a certain age, teenager, when you go see a GYN, they always tell you, you do your pap test. They call it pap test over there. But it's only at an adult age that I knew that it was related to cervical cancer.
Oh.
Yeah,
you do the test, but not knowing what it is for.
No, yeah.
Yeah, and also I think insurance is something that's very important for women. That helps them to be able to do that. Because if you're asked to do it frequently,
here in the US,
here in the US, so it's a good thing that a lot of insurance can cover.
I mean, I grew up in Ethiopia, in Africa, and honestly speaking, before I came to the US, I knew nothing about such kind of screening. It's after I came here that I started doing it every 2 years, and that's because I went when I got pregnant, and I went and they told me, do you do this screening? And I've never done it, and they said I have to do it every 2-3 years, and that's when I started doing it.
Wow, man.
So yeah, I mean, I'm sure there are a lot of women like me who know nothing about this cancer and why it's called. But cervical cancer is one of the most successfully preventable and, if diagnosed early, one of the most treatable forms of cancer. But according to the World Health Organization, 70,000 women in Africa die every year due to cervical cancer. This high rate of deaths among women in sub-Saharan Africa is largely attributed to low cervical cancer screening programs due to inadequate health systems, lack of emphasis on prevention, and lack of health literacy among the population as well as healthcare workers. Most women in Africa are diagnosed at advanced stage of cancer, which oftentimes is too late to cure. On this week's episode of Our Voices, we will discuss what cervical cancer is, what the symptoms are, and why it continues to present significant public health threat to women in the Africa continent. We will also hear from experts on ways to ensure increased medical access for timely detection, care, and prevention.
Well, in Nigeria, the country is targeting 8 million young girls for the pilot phase of a mass vaccination campaign to protect young girls against cervical cancer. Nigerian authorities recently held a national rollout of the human papilloma virus, the HPV vaccine, the virus that mostly responsible for cervical cancer, and said the vaccine will be included in the country's routine immunization program. Timothy Obwezu was at the launch of and filed this report from Abuja, Nigeria.
Around 8,000 people in Nigeria die of the human papilloma virus each year. Students are singing, dancing, and serenading guests and officials at the Abuja national rollout of the HPV vaccine. The vaccination drive is the latest effort by Nigeria to reduce cervical cancer and targets 7.7 million girls, the largest number in a single round of HPV immunization in Africa.
This vaccine is aimed at, is targeted at preventing the human papilloma virus. So today, officially, the federal government has made a huge investment by introducing this vaccine free of charge into the routine immunization schedule. What that means is that our girls between the ages of 9 to 14 years can freely access this vaccine. The strategy is for us to see that by 2030, we're in 2023. By 2030, that we have drastically reduced to the barest minimum the incidence of cervical cancer in Nigeria.
Nigeria is aiming to inoculate about 18 million girls against HPV by the year 2026. 13-year-old Emanuela Moses is happy to get the jab.
I'm happy because I won't get the disease as VPH, yes. I don't want to get the disease at all, so I'm happy that they came to our school and give us the vaccine.
Cervical cancer is the second deadliest among women in Nigeria, killing nearly 70% of the over 12,000 cases reported every year. The Nigerian Institute of Medical Research says an estimated 36 million women and girls aged 15 and above are at risk of developing the condition. Poor access to screening facilities, late presentations in health centers, and inadequate treatment services are the reasons for the high fatality rate. But authorities also say myths and misinformation about the disease play a role. That's where Regima Community Care Foundation enters the picture. The foundation has been making communities and schools aware of the condition and the vaccine even before the launch. Ndayo Iwat is the founder of the non-profit.
We dived into areas of vaccines and their attitude towards vaccine, that is in terms of compliance or otherwise. So, and we agreed with them that today we are going to sensitize the whole school. And this is a junior secondary school with a population of over 2,000 students. We have more girls than boys. The first thing to me is that we'll be able to integrate people with special needs. You can see those children with special needs, the deaf, the dumb, and others. They were here.
12-year-old Farida Abdul Fatai says her family is skeptical about the vaccine.
I asked my mom, like in Nigeria, people are scared for vaccine because it has side effects. Like the coronavirus vaccine. It's not that it doesn't work, but it has side effects. But she might change her mind, yeah. So I will try to convince her for me to get the vaccine.
The second phase of Nigeria's vaccination campaign is expected to begin in May 2024 across 21 states. Meanwhile, Nigerian authorities and non-profits like Regima Community Care Foundation are working hard to ensure that many more girls are possibly safe from cervical cancer. Timothy Obiezu, VOA News, Abuja, Nigeria.
Well, being diagnosed with cancer is both shocking and scary. But the good news with cervical cancer is if it's detected early, it's highly curable. To learn more about that, we invited Tamika Felder, a survivor of stage 2 cervical cancer and the founder of Survivor, a non-profit that is dedicated to eliminating cervical cancer, as well as giving survivors a powerful platform. Tamika, thank you so much for joining us.
Thank you for having me and shedding a spotlight on this topic that we really do need to talk about.
Indeed, Absolutely. We do need to talk about it. So you were only 25 when you learned that you had a cervical cancer. How did you find out, and what was your reaction?
It was through a pap test, and it was 2001, and so we didn't have a vaccine yet. We didn't even have HPV testing.
That's the routine screening.
Correct. And, you know, I knew in my body I had a cervix, and I feel like I'm a knowledgeable woman, but I didn't know what the testing was for, you know, what was the purpose, all of this other stuff. And so when it happened to me, it came out of nowhere. And so I ended up losing my fertility, but I didn't lose my life, so that's a blessing. But now I want other people to know what they need to know about cervical cancer, how to protect themselves, how to protect their children, because no one should die or lose their fertility from cervical cancer.
Help me understand something. So the cervical cancer is caused by human papillomavirus, HPV, and it's sexually transmitted. Does it mean that one person carries the virus and can transmit it to other women?
So the human papillomavirus, or HPV as it's commonly called, is also like the common cold. So at some point, every single person will have HPV, whether it's papillomas or warts on their fingers or wherever. But in some people, it will cause cervical cancer or some of the other 5 cancers. There's 6 altogether that HPV causes. And yes, is it sexually transmitted? Yes, from skin to skin contact. But what happens is people get caught up on that and the stigma rises. So then people don't want to be associated with it. They don't want to get screened, or they think it won't happen to me, it won't happen to my child. But the unfortunate thing is people are still dying of cervical cancer and HPV related diseases. And so we need to eliminate that stigma because it just shouldn't be.
That's right. I mean, and also, you know, the fact that women have to get tested very often. So
and there's
to
no
make
test
sure.
for men, so that's why we have to get boys and girls
That's a good point.
vaccinated.
Now, your organization is working on eradicating this cancer. And what preventive measures and what other strategies that you're using to help with the awareness part of it?
Maybe together with that, you will also recognize at the White House for the work you do, so you can tell us that.
Yeah, and that really is important. You know, all the accolades are great. Who doesn't want those? But at the end of the day, when someone says, I hadn't been screened, but I heard your story, or I went on the website and I saw other stories and I went and got screened. When someone from Africa is wearing a survivor t-shirt, or they're, you know, got their survivor towel, or they're, you know, or a European country that I've never heard of, and they understand the message. Because I know I could have easily been on the side of someone who succumbed to cervical cancer, right? And so for me, I want to support those who are diagnosed with cervical cancer, but I also want to help prevent it. We, unlike any other cancer, can eliminate cervical cancer. Now, when I was first diagnosed and I heard that, I was like, what are they talking about? Like, no. I believe it, I know it, I've seen the data. We see what's happening in Rwanda, we see what's happening in Australia. There is no reason why it should not happen in the United States of America, on the continent of Africa, or anywhere else. But there's a policy issue. So we need everybody to join in, and we need to normalize it so that, one, women are getting screened, boys and girls are getting vaccinated, and cervical cancer is eliminated worldwide.
So what's the easy way to do prevention or awareness, you think, in your view?
You know, first is awareness. People need to know what are the risk factors. People need to know that it's extremely common. People need to know that we have tools. We have tools to detect a virus, but we also have tools to prevent it. Those are the basics.
Okay, Tamika, we'll be right back. It's now time for a break. We will continue our conversation on more preventive measure and why it's important to eradicate this cancer. We'll also love to hear from you on social media platforms. We are on Facebook, Instagram, and Twitter, and our handle is at VOA Africa. Use the hashtag VOA Our Voices. Don't go away. We'll be right back.
In times of change, when the world seems uncertain and what we hear doesn't reflect what we see, we seek the truth. When we are told only part of the story, we lose trust. In moments of crisis, our dreams, hopes, and wishes for a better tomorrow depends on a free press. At Voice of America, we bring you the stories that people take risks to see. We connect the world and unite it with truth. At Voice of America, we show you the whole picture.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linor Moudou, in Washington, every week on Healthy Living, right here on VOA.
Welcome back. You are watching Our Voices, and we are discussing why Sub-Saharan Africa has high prevalence rate of cervical cancer and how to prevent it. And with us in the studio is Tamika Felder, the founder of Survival. We also have another guest joining us via Skype from Senegal, Dakar, Dr. Katine Ndiaye. She is a public health expert, epidemiologist, and director of HPV vaccine programs at PATH. She mainly focuses on cervical cancer prevention through vaccinating young girls before they are exposed. Dr. Ndiaye, thank you so much for joining us.
Thank you for the invitation. It's a pleasure.
Yeah, first, let me ask you, if cervical cancer is treatable and if there is even a vaccine to prevent it, why do we have so many women dying in Africa from this cancer?
Yeah, thank you. This is a great question. Actually, the primary reason many African women die from cervical cancer is because they don't have access to the screening services and treatment. It is estimated that about 80% of women see a healthcare provider when they are already at an advanced stage of the disease. I think you mentioned earlier that when found early, cervical cancer is highly treatable. It's one of the rare cancers that we can prevent through vaccination and early screening and treatment. But the lack of awareness and the lack of resources are driving the high burden in many African countries.
Yes, Ms. Ndiaye, now my question is really about awareness, and after we watch this next clip, it'll cement why. Before we go to that question, let's listen to a woman from the continent on how they know about cervical cancer or if they take any preventive measures. Our reporter Tuso Kumalo talked with women in Johannesburg, South Africa, and we have Erica Kumalo, Nolutando Nkonyane, Melanie Wicks, and Mogadi Sikete, and Novole Nomvelo Klapo in our Your Voice segment, and we'll be right back, okay?
I wouldn't say I know much, but at the top of my head, I would say it's cancer, and cancer is dangerous, I guess.
I think cervical cancer is, well, besides the obvious, it's a cancer that affects the cervix, and only women have cervixes. So it's a cancer that affects the cervix in females.
No, but I know about cancer, but not cervical cancer because I lost my one sister for breast cancer.
I know one fact, which is that it causes severe bleeding outside of your cervix, but I can speak more to the psychological effects. I feel like having cervical cancer is something that causes psychological disparity between who you used to be and who you are, especially when you become diagnosed. I feel like as women, problems with our bodies have an inferiority complex. You kind of feel like you're not a full woman because you have cervical cancer, or you're not able to live the life that you used to live purely because you have cervical cancer.
Honestly, I'm not doing anything to prevent it. I'm not doing anything besides protecting myself in sexual things, using the condoms and stuff. Yeah.
It's amazing how much many women don't really know much about cervical cancer, and which brings us to the awareness question, Ms. Ndiaye. Why do you think that medical systems aren't really, bringing the awareness? Tamika said that there is stigma because it's a sexually transmitted disease. Why don't we have more awareness, and what can we do about that?
Good question too. I think the main issue we have in many African countries is the lack of resources, financial resources, human resources. But to be able to conduct a good communication plan and conduct social mobilization activities, you need the funds to implement those activities. I think that's one reason. And once we are able to spread the word, increase knowledge about the disease, I think it will help a lot. Usually people just don't know. Once you tell them, they say, oh, really? Where can I get the vaccine for my girl? Where can I get screen now? So it's just a lack of resources, and we need to implement these screening programs and these treatment facilities.
Ms. Jai, so this vaccine is pretty new. Was it made in 5 years ago?
No, actually, it's not so new. No.
No? Okay.
I believe, no, yeah.
2006.
It's been around for a while.
2006. All right.
2006.
So how many vaccine a person needs in a lifetime? Is there boosters?
No. Actually, only young girls aged 9 to 14 in Africa can get the vaccine. In other high-income countries, girls beyond age 15 can get the vaccine, up to age 25, or sometimes even older women get the vaccine. But in many African countries, we get funded to implement the HPV vaccination program through Gavi. It's an organization that provides the vaccine for free and helps also with the implementation activities. So girls age 9 to 14 can get the vaccine with 2 doses. It's been 2 doses up till December of the last year. There was a recommendation by the WHO to say that now there's enough evidence to switch to 1 dose. So now the good news is that 1 dose could be sufficient to protect young girls against the HPV virus.
I think it's so wonderful what you're doing. I mean, as someone who's experienced cervical cancer firsthand and also works with survivors around the world and patients, we know that this is a global burden. And we know that it's a policy issue. We have to make the vaccine not only more affordable, we have to have that access. So you're absolutely spot on. And we know that the vaccine is safe because, again, it's been out since 2006. The data is there. Millions of doses have been given. And we also have to make sure that people know the facts, they understand, and as you said so eloquently, when they know, and they'll want it.
Yeah,
Awesome.
Yeah, exactly.
The goal is to eliminate also cervical cancer by 2030 as put by WHO. Is it achievable, especially in Africa?
I like to be optimistic. So in 2020, WHO launched a global strategy to eliminate cervical cancer by 2030. The goals are to vaccinate 90% of girls who are eligible for the vaccine, screen 70% of women first at age 35 and then again at age 45, and then treat 90% of women who were diagnosed with the disease. It's very ambitious, I have to say, but I think we are really making a lot of effort to make this happen. It's true that currently in Africa, vaccination coverage is below 15%. So we have a lot of progress to make by 2030. But more and more countries are introducing the vaccine. More and more countries are really putting all the resources, whether it's human resources, financial resources, everything to make this happen as soon as possible.
Thank you. Thank you so much, Dr. Katin Diaye, the Global Director for HPV Vaccine Implementation Programs at PATH, for joining us.
Thank you.
Thank you so much. So, Tamika, you have been cancer-free.
22 years.
22 years. Congratulations.
Thank you.
Yes,
Thank
and
you.
I mean, you are enjoying life. You are supporting even your community. Is there anything you want to say to other women who are struggling with this cancer?
That they're not alone. You are not alone, and I know exactly what you're going through. Do not go through this alone. We have people all over the world willing to support you at every level. So reach out. You can find me all over social media and at
also
Survivor.
there are women, even with the treatment, who struggle with the life change that comes.
Yes.
For example, you said you lost your fertility. So
But there's
how
sexual
do they...
dysfunction. There's going into surgical menopause. There are just the new normal, knowing your new body, your limitations, and you know, you have to worry about secondary issues, you know, bone loss, which affects things. You know, you have to worry about, will the cancer come back? And if the cancer comes back, how do I deal with that?
Right.
So there are always things.
You've been in different countries, in Rwanda, in South Africa, and we hear Eswatini is one of the countries that are hotspot when it comes to cervical cancer. Are you planning to go there as well?
I would love to go there. I have a wonderful friend who's doing work with the children who are left behind. And I wondered why there were so many children that this, you know, organization would go there and do this. And then we had this wonderful doctor, Dr. Pender, out of Cleveland, who does a lot of work in Africa. And she came and she had this slide, and East Watini had the highest incidence of cervical cancer. I couldn't believe it.
Do we know why?
You know, again, lack of access, lack of...
And I think also misconception. We heard a girl from Nigeria saying her mother doesn't want her to take the vaccine because she thinks it has side effects and it will affect her, right?
There's a lot of misinformation out there. And so social media is wonderful because we all can be publishers. It's also a dumpster fire because we all can be publishers, and we can write and post anything we want. And the people who follow us, they believe it. So we have to have people be responsible with what they put out there. A lot of people share things, but they don't read it. Now social media is saying, do you want to share this anyway, even though you haven't read it? So we have to do more of that because there's a lot of misinformation.
Wow. Is there any side effects with the vaccine?
So there are burning when you get it. This vaccine burns, and that is really it. So there's some people who may need, if they may have issues with needles, they need to stay and just wait a little while longer. But
nothing on your health.
Nothing.
Okay.
There are so many people who have been vaccinated and haven't had any issues. You know, there's always going to be people that are in that minority, that small percentage that have whatever reactions to vaccines.
And you know, a lot of time in Africa, they're afraid of infertility to begin with, so they might fear that this vaccine might actually cause infertility.
Their whole life, infertility
because
is a stigma, even to be with the society.
So I think that's what's going to be a big push.
You know,
and that's good to just talk about that. That's one of the things we should talk about.
Yeah, I meant to ask you, when you have the treatment, do you have to have like that fertility treatment, you know,
rest of your life?
Yeah.
Yeah. So for me,
for every woman,
it's not for life maybe, but I think that's where to start from. That's where we end our show for now. Thanks Tamika Felder, the founder and chief visionary of Survivor, for joining us here in our studio. And we also want to thank Dr. Katin Diaye, Global Director of HPV Vaccine Implementation Programs at PAS Center for Vaccine Innovation and Access, who joined us from Dakar, Senegal. Last but not least, we want to thank our editorial and production team on Our Voices. To catch up on the latest episode of Our Voices or to stay up to date with the news from around the continent, go to voaafrica.com or our YouTube channel. We'll see you again next week with another exciting program. Goodbye.